I'm talking about Feline Leukemia virus. I work at an animal shelter, and so every cat that comes in gets tested for this because it is kind of common. So what it is, it's an RNA gamma retrovirus that infects about 3 to 14% of cats worldwide. It weakens the immune system, which further causes other sicknesses like lymphoma, leukemia, and other infectious diseases. It's spread through saliva, nasal secretion, urine, feces, or milk from the mother cat, which means kittens are highly susceptible. And then symptoms. Sometimes no signs are seen. The virus can lay dormant in the animal for a while, so you may not be able to see the symptoms. But if you do, some of them could be repeated cycles of illness because their immune system's weakened. They can have loss of appetite, weight loss, poor coat condition, inflammation of the gums, eye conditions, anemia, poor healing, or chronic respiratory problems. And then, so to diagnose, you can use the ELISA test, which is it's a blood test that detects for the feline leukemia particles in the bloodstream, which can be done at a vet's office. And then you can further test to a more accurate one, the indirect immunofluorescent antibody assay, which detects the virus in the white blood cells, which indicates there is a more severe infection, and that's through a diagnostic lab. So there's 3 stages of the infection. There's an abortive, which means that the cat can fully clear the infection on its own. It's a little more rare. Usually they have it for the rest of their life. Regressive is happens about 10% of the time. It means that it has it temporarily, but can get over the symptoms of it, but it will still be a carrier for the virus for the rest of its life, so you don't want it with other cats who don't have the disease. And then progressive is the most common, which means it's contagious to other cats and actively infected, meaning that it's like a continual progression of the disease, like it'll continue to affect them. So there's no treatment at this time. Once your cat has it, you just have to hope that it can get over it by itself. But the good thing is that they can still live a pretty normal life. They can live for up to 2.5 to 3 years still after, depending on how severe the virus gets and how it affects them. A couple things you do want to be careful about if you know you have feline leukemia positive is to monitor their weight, activity, appetite, elimination, appearance, and behavior. Any changes could be a sign, and you want to catch it as soon as possible so you can treat it before it compromises their immune system. You could do vet visits at least twice a year if you really want to be safe, just to make sure that your animal is healthy and not hiding anything. Spaying and neutering your cat is always good, and then keeping your cat indoors so that it's not infecting other cats and also not getting injured or sick, which can cause increased disease. To prevent it, you should keep your cat away from other infected cats or those with an unknown status. Again, keep your cats indoors or supervised outdoors, because even if your cat doesn't have it, you don't know what other cats around might have it. Don't share food, water bowls, or litter boxes between infected and non-infected. Vaccinate against FeLV. It's not a core vaccine, but you can get it from a vet's office. And then clean anything that may have come into contact with the infected animal. The virus can't survive long outside the body, so as long as you clean well, you should be fine between animals. And then the other common disease that we also test for at the shelter is feline immunodeficiency virus, and that's a little bit different. So FIV is transmitted mainly through bite wounds, while FeLV is more commonly can be transmitted through saliva or any other excretions. FeLV has some cases left animals healthy, but FIV does not have a cure, so if you test for it, you'll always have it. FIV is also progressive in destroying the immune system, while FeLV can be dormant for a long time. Again, they can be carriers but not show symptoms. FIV vaccines cause the FIV test to show positive, which is one controversy in giving the vaccine to them, because once you do, then you can't, or it'll always test positive. But the FeLV one doesn't test positive if you vaccinate them. And then neither of the viruses last very long outside the body. And that's the sources.
Okay, let's give her a round of applause.
I'm glad you compared those two viruses because those are very common. Questions, comments, experiences with these diseases? So now refresh my memory. Oh, here we go. Go ahead.
So at the shelter, what do you do when these cats come in? Since they, you can't have them around other cats.
Right. We
Now are
actually,
you referring to the leukemia virus?
Yeah.
Okay.
yeah, so we actually have a cat right now who's FIV positive, and he's actually set up in the lobby, away from all the other cats. So we're a no-kill shelter, and so we just kind of separate them from the other cats and make sure that we don't cross-contaminate.
Yeah, I think with ours, like, since they're kind of in like fairly big cages, they usually don't really come into contact with you.
So as long as you keep. Now, what's the one that you? Is it the leukemia or immunodeficiency virus that you should have that cat isolated totally? Because I thought if they have the FIV, they can live with other FIV cats.
Generally, feline leukemia is more commonly spread through any other secretion, so that's why it's more like dangerous. I guess.
Okay, I got you.
Yeah.
So the leukemia one is more likely
The
to
other
spread
one is just mainly through bites.
through bites. And if they're getting along okay, they're not going to spread. Common questions, others, experiences? If not, that's it, because our third person is ill. And you got the new assignment, right? I added a twist there. People are telling me that, it's hard for them to print sometimes because of the costs and everything. So, Katie, is this your flash drive? So the assignment, it's due a week from this coming Wednesday. Parker, don't get up. We'll get your crutches to you. Okay, see you guys Wednesday. Super.